Welcome back. You're watching Plain Speak with me, Priha. Now, amid a COVID-19-like outbreak in China, which is seeing a surge in human metapneumovirus or HMPV, a respiratory illness with symptoms of a cold, Indian health experts are exercising caution with 2 cases now being detected in Bengaluru in Karnataka and 1 case being reported out of Gujarat. Maharashtra and Delhi have issued a health advisory amid the health scare. There have been speculations on whether the virus will be impacting India or it will be bringing back the COVID-19 days. And that is a major concern, although we have seen the Union Health Minister, Mr. J.P. Nadda, come out and allay all of those fears. However, we are looking at the surge in cases which are primarily impacting children and the elderly. Young children with developing immune systems are particularly vulnerable, and that is causing a great amount of concern. So we are asking today, amid this HMPV chaos, whether HMPV chaos in China will lead to worries in India. Should India really be worried? Let me take this, in fact, across to my guests who are joining us on the broadcast this evening. Dr. Manoj Kumar is the Principal Director, Cardiac Sciences, Max Hospital is with us. Also with us is Bhavya Narasimhamurthy, spokesperson of Karnataka Congress. In fact, let me begin with Dr. Kumar. Since we need your expert inputs and advice on this new virus that is upon us, nothing to worry, or there is reason enough to worry? Because we are learning that this is an existing virus, it is not a new one.
I agree that it is not a new virus. It is existing since 2001 and may be possible that it was pre-existing even before 2001. But the important thing, it is a RNA virus. It is an enveloped RNA virus, just like COVID was also RNA virus. Very high capacity for mutations. And infection induces immunity for a very short time. So there is always a chance of this kind of characters virus, if carries, then there is a high chance of a spread. I heard the press conference of our Honorable Health Minister. No doubt it is not a time for panic, but we require some precautions because vulnerable age group is children below 5 years, elderly above 65 years, and pregnant ladies. They are also a very vulnerable population. We should understand. So these subgroups requires COVID-appropriate behavior, just like COVID-appropriate behavior. You have to cover your face with with the mask. You have to keep a social distancing and keep hand hygiene very perfect, because this is also a droplet infection. This is spreads by the contact and by the touching the surface and then touching your mouth. So definitely it is a concern, because when COVID started, we just started counting 10 cases, 20 cases, and it came to millions. So now the right it is only 3 cases, 2 in the Bengaluru and 1 in Ahmedabad. But Ahmedabad case, the child became very sick. She requires the ventilatory support, but by grace of God, she is recovering, and she responded to all the supportive treatment. There is no specific antiviral therapy for this HMPV. There is no vaccine, so we need precautions. But definitely, alert situation is there, but not a panic situation.
All right. Let me also, on this note, introduce my third guest who's joining me on the broadcast, Dr. Arin Kumar, who's the chairman of the Chest Surgery and Lung Transplant in Medanta Hospital. Dr. Kumar, thank you so much for joining us. But before I come to you, let me bring in Ms. Narasimhamurthy. Considering 2 of the cases have come out of Karnataka, and we'd heard the Karnataka Health Minister, Mr. Gundu Rao, really claim that there's nothing to worry. However, this third case from Gujarat in Ahmedabad really has caused a lot of worry because of the situation of the infant really going out of control, and of course there was immediate intervention that was required. Ms. Narasimhamurthy, has there been an advisory that will now be put in place now that the Union Health Minister has also spoken?
Today in the morning there was an emergency meeting that was convened, and to consider the seriousness of these virus, and as even the central government has also not issued any advisory so far. But as per the experts, I'm sure there will be some advisories that will be issued soon. But as far as the experts, what experts believe is, it is not of we need not be panicking, or it's not alarming so far. But I'm sure the doctors in this panel have a better
Okay, all
comment
right.
to make. Yeah.
All right. So,
But
Dr.
definitely
Kumar,
the government is doing everything in its
sure.
capacity to make sure, there is no spread of this. The family of the kid who was diagnosed, they are being also quarantined, and all such measures have been taken. And it's one of the relief is that this child doesn't have any travel history, or anyone who has come in contact with the child is not tested positive. So that is one relief.
Okay.
Hopefully the child gets better
So,
sooner.
Dr. Kumar, I'd like to understand this very point and this very aspect from you, considering both these infants who have been diagnosed with the HMPV in Karnataka specifically have also, we are learning, have had no travel history, so to speak. How is this virus really impacting people in the country, considering earlier what we'd seen with the COVID-19 strain is that the virus was coming in from China, if there are people traveling in and out of country, and that was the reason for the increase in the number of cases in India. But this is not the case with HMPV. So is this becoming a greater concern, considering this is an existing virus and might suffer mutations that, Dr. Manoj Kumar was also talking about?
Griha, thank you very much for having me on the show. A lot of information has already been shared by my colleague, Dr. Manoj.
Yes.
Your question was that these kids did not have travel history. Then how? So let me tell you that this virus is not a new virus. It belongs to a family called respiratory syncytial viruses, and these viruses are there. They are known since the year 2000, and they often cause influenza-like illness, particularly during these winter months. This virus is known to affect children and elderly. Children because their immunity is developing, and elderly because their immunity is relatively low. So although adults are also not immune, but by and large it affects children and elderly, and predominantly it causes a simple influenza like illness, which is running nose, fever, etc., etc. For 3 to 5 days. It's a self-limiting disease, but sometimes it can even lead to serious infection and requiring admission, ventilation, etc. So it's not something which has come to us from China. This virus is there in the environment. Maybe before this also, till last year also, maybe we were having a lot of this influenza because of this virus, because of the surge in infections in China, and an advisory issued by the health authorities there. I think there is a renewed focus on looking for it, and that's why we have found it. So how I would summarize is that, yes, we should be cautious, we should be careful, but right now there is no need for panic or overreaction. I think caution is what is the need of the hour. Maybe we can start some COVID appropriate behavior for the time being, so that in case you have influenza like illness, please avoid going out into public spaces and crowd. This you can do as a service to other people.
Sure.
And put on a mask. And if anyone, from particularly children and elderly, they are going to crowded places and all, they must put on a mask. So for the time being, selective use of mask, and children and elderly avoiding going to crowded places is the only two precautions I would recommend.
So, Dr. Manoj Kumar, you mentioned about one of the cases out of Gujarat specifically, where the child, the infant that in fact was known to have HMPV, it led to a serious sort of infection in her case. When such a thing really happens, and here we're talking about infants, masking is not a possibility in that case. And if the infection really becomes that dire and serious, what does one do?
As Dr. Arvind said, that it is a pre-existing virus. So all winter may, so whatever illness we get, 20% is caused by this, almost 20% is caused by this HMPV. Out of this, 5 to 10% cases worsen. So we are expecting that some of the cases will require intensive care, some will require ventilatory support. So out of 3, 1 because numbers is less, so we cannot predict how it will behave. But since the nature of the virus is a RNA virus, and it can worsen, it can cause severe bronchiolitis, bronchopneumonia, ARDS, pneumonia. So we should be very careful, especially in cases of children. And you rightly said that masking is not an option for the children or pediatric age group, and especially this these are very small child, means they are less than 1 year old. So we have to prevent anybody in the family, if any signs of upper respiratory infection, they should keep the kids away from them, because in our Indian culture, even somebody has infection, they cares for the baby and they play with the baby. So I think they should be isolated, and any infected person should be isolated. And since there is no vaccine available, only prevention is the measure by which you can reduce the rate of infection. And treatment is purely symptomatic. So whenever you find that there is simple URI or influenza-like or common cold-like symptoms, you can treat by medicines. But if it deteriorates, if fever persists, you have to go to the hospital and consult.
So after speaking to all of you, I have realized one thing, that there is no reason to get worried just yet. And we'd also like to, in fact, put it out there for our viewers yet again, that post-COVID-19, there has been a lot of behavioral changes that people have, in fact, brought about in their own personal life. If anybody is going through a common cold, they do eventually mask up when out in public, and that is something that has become a requirement now, that we are also learning of HMPV. But this is something which is an existing virus, and one should just exercise caution.